I wanted to review your most recent laboratory studies. The complete blood count. The complete blood count is a simple blood test that measures the number of red blood cells, white blood cells, and platelets in the blood. It can check for anemia. It is a common test, often used as a screening test that gives a picture of a person's health status. It can be used as the first step to screen for a wide range of medical conditions, including inflammatory disease. We would need to check a complete blood count before starting medication. The chemistry profile. The chemistry profile measures a variety of chemicals and enzymes in the blood to provide very general information about the status of organ health and function, especially the liver, kidneys, and pancreas. This profile includes levels of sodium, potassium, chloride, carbon dioxide, calcium, protein, liver function tests, and blood glucose. We would need to check the chemistry profile before starting any medication. The serum protein electrophoresis test is a test for protein elevations. It is a laboratory examination of protein levels that are commonly used to identify patients with multiple myeloma and other disorders of serum protein. Elevations of these proteins have been found in persons with joint pain. The anti-neutrophilic antibody, cytoplasmic antibody, is a test for vascular inflammation. It's also known as the ANCA. It's a blood test used by doctors to help the diagnosis of autoimmune disease. It is commonly elevated in patients with diseases such as granulomatosis, polyangiitis, microscopic polyangiitis, EG, and Sjogrens syndrome. Elevation in this antibody can be found in patients with joint pain. Uric acid level. The uric acid is a test for gout. It is also known as the serum uric acid and determines how much uric acid is present in your blood. The test can help determine how well your body produces and removes uric acid. Most uric acid is dissolved in the blood, filtered through the kidneys, and expelled into the urine. Sometimes the body produces too much uric acid and doesn't filter out enough of it. Hyperuricemia is the name of the disorder that occurs when you have too much uric acid in your blood. High levels are associated with a condition called gout. Gout is a form of arthritis that causes swelling in the joints, especially the feet and big toe. The CPK. The CPK is a test for muscle inflammation and damage. It's also known as creatine kinase, CPK or CK. It's an enzyme found in your heart and blood and brain and skeletal muscles. When the muscle tissue is damaged, CPK leaks into your blood. Therefore, high levels of CPK usually indicate some sort of stress injury to your heart or other muscles. Elevated levels have been associated with the C-reactive protein. This is an index of inflammation. It's also known as CRP. When there's inflammation in the body, the liver produces a protein called CRP. A high CRP level indicates an inflammatory condition, including an infection. For this reason, a high CRP is not necessarily a strong indicator of RA, but specifically supports an RA diagnosis. In addition to CRP lab tests, doctors often use this test to monitor a patient's response to treatment in addition to diagnosis. Serum ferritin. A ferritin blood test can help your doctor figure out whether your body has too much iron. High levels may point to alcohol abuse, infection, liver disease, rheumatoid arthritis, overactive thyroid, or some types of cancer. It measures how much iron is stored in your body and can be a marker of inflammation. Elevated levels of ferritin with high iron levels may be associated with aches and pains. The iron level. The iron level can show you if you have too much or too little of this mineral in your system. It can check for conditions such as anemia. There's 3 types of iron tests, which include the serum iron, which measures the amount of iron in your blood. Total iron binding capacity tells you how much transfer in a protein is free to carry iron through your blood. And unsaturated, or UIBC, iron binding capacity, which measures how much transfer isn't attached to the iron. The TSH. This is a test for the thyroid. It is called thyroid stimulating hormone. It measures the amount of TSH in the blood. TSH is produced by the pituitary gland, which is located at the base of your brain. It's responsible for regulating the amount of hormones released by the thyroid. Elevated levels of this hormone may be associated with lab aches and pains. Vitamin D level. The vitamin D level measures vitamin D. Vitamin D is essential for strong bones because it helps the body use calcium from the diet. Known as the sunshine vitamin, It is produced by the body in response to skin being exposed to sunlight. It also occurs naturally in a few foods, including fish liver oils, and egg yolks, and in fortified dairy and grain products. Low levels have been associated with aches and pain. The antinuclear antibody. This is a test for lupus. It's a blood test that looks for antibodies to proteins found in the cell nucleus. The nucleus is essentially the brain center of any cell. There are many different types of proteins found in the nucleus, and they can all be targets for an immune attack. The ANA test is a test to see if there are any antibodies in the blood that are attacking any of the proteins found in the nucleus. The ANA is a screening test for autoimmune diseases, including rheumatic diseases and non-rheumatic diseases. It's not specific to a single disease. A strongly positive ANA makes it more likely that a person has an autoimmune disease, but it does not distinguish between different types of autoimmune disease. However, if the test is positive, there are clinical features of an autoimmune disease. Other, more specific tests will be ordered. After the blood is drawn, it is sent to a lab which is diluted with saline solution and tested for the presence of antibodies based on the titers and the dilutions that are found. The rheumatoid factor. The rheumatoid factor is a test for rheumatoid arthritis, as it measures the amount of rheumatoid factor in your blood. Rheumatoid factors are proteins produced by your immune system and can attack healthy tissue in your body. It is a blood test that looks for antibodies called rheumatoid factors. These are autoantibodies that are produced by the immune system that can attack a variety of healthy tissues. It is usually ordered when a person is suspected of having rheumatoid arthritis or other rheumatic diseases. The test is not very specific. In the early stages of rheumatoid arthritis, about half the people will have a positive rheumatoid factor and the other half will have a negative. So having a negative rheumatoid factor does not necessarily rule out a diagnosis. 75 to 80% of people will show a positive rheumatoid test. It can be helpful in diagnosing rheumatoid arthritis, but since not everyone with rheumatoid arthritis will test positive, doctors interpret the test in the results in the context of a person's other signs and symptoms as well as results of other tests. The anti-CCP, that is another test for rheumatoid arthritis. It is an antibody present in most rheumatoid arthritis patients. It measures anticyclic citrulline peptides, which is a blood test that looks for these antibodies. This is a type of autoimmune antibody, which is an antibody produced by the immune system that targets the body's own tissues. These tests are otherwise known as ACPA, target a type of protein called the citrulline protein that can be found in some people's joints. It can be helpful in diagnosing rheumatoid arthritis. Approximately 60-70% of people who have rheumatoid arthritis will have this test. The SSA and SSB are a laboratory test for Sjogren's syndrome. Sjogren's syndrome is a condition where it's characterized by dry eyes and dry mouth. These are marker antibodies for the test. 70% of patients with Sjogren's are positive for the SSA or Rho, and 40% are positive for SSB. These tests may be also found in lupus. It's a blood test that detects human autoantibodies to nuclear antigens and are used to support a diagnosis of Sjogren's syndrome. Sjogren's syndrome can be associated with aches and pains. Additional tests. If you're continuing to have joint aches and pains, we may need to consider tests for celiac antibodies, Saccharomyces antibodies, the vector test, which is test for inflammation, Lyme's titers, a chest x-ray for possible sarcoidosis, as well as we may need to explore other types of inflammation with hand sonograms. Thank you.